This lecture is on leukogram patterns. Listed here are the most common leukogram patterns. When you see the terms acute and chronic, they are used to describe the leukogram pattern and do not necessarily mean that the disease is either acute or chronic in nature. So for example, you may see an acute inflammatory leukogram in an animal that has chronic disease. When trying to discern which pattern is present, it's most helpful to focus on the neutrophils and the lymphocytes and see what they're doing, and that's because these cells are the ones that most consistently change. If bands are present, then you automatically have an inflammatory leukogram, and then you look at the lymphocytes. Lymphocytes will be decreased with acute inflammatory leukogram and increased with chronic inflammatory leukogram. A mild neutrophilia without a left shift and without toxicity is most likely to be a stress or physiologic neutrophilia. And then you look what the lymphocytes are doing. If there's a lymphopenia, it's a stress leukogram. If there's a lymphocytosis, then it's a physiologic leukogram. Stress leukogram is completely due to the action of cortisol. However, an acute inflammatory leukogram is due to a combination of inflammatory cytokines and cortisol. The inflammatory cytokines cause the changes in the neutrophils, but the cortisol causes the changes in the lymphocytes, monocytes, and eosinophils. So you see the acute inflammatory leukogram and the stress leukogram actually have a similar pattern with regards to lymphocytes, monocytes, and eosinophils. Mechanisms for increases or decreases in each cell type has been previously explained in the prior lectures, except for the changes in the monocytes, so I'll talk a little bit about monocytes now. Stress causes a mild monocytosis due to shifting of monocytes from their marginal pool to their circulating pool. So like the neutrophils with stress, the monocytes also become less sticky and move from the endothelium into the circulating blood. However, with chronic inflammation, monocytes undergo hyperplasia within the bone marrow, which results in a monocytosis. The last leukogram pattern is called a leukomoid response, and it is an inflammatory neutrophilia that exceeds 50,000 neutrophils per microliter. And specifically, that's the sum of all neutrophil stages combined, so bands plus segs plus earlier precursors. Causes of a leukomoid response are listed here. So if a patient has a leukomoid response, you should investigate into the possibility of one of these diseases.